afternoon, dear chairman, dear audience. Let me introduce my PhD projects. I'm Dr. Koppány Kocsis. I'm working as a specialist in Orthopedic Traumatology Department in the Uzsoki Hospital. My vision is give a better attendance to our patient with more accurate and faster diagnosis. To gain this aim, my research will be the comparison of the accuracy of ultrasonography and MRI assessing to injured lateral ankle ligaments and medial collateral ligament of the knee. My first topic is comparing the diagnostic accuracy of ultrasound and magnetic resonance imaging assessing in anterior talofibular ligament injury and calcaneofibular ligament injury. The ATLFL is one of the most frequent injured lateral ankle ligament. The typical mechanism of the injury is an inversion trauma when somebody steps into a hole or on a ball, and it makes a supination stress. It's very often injured ligament, but we didn't have any evidence that a clinical test can grade correctly the level of the injury. When we want to know nowadays how serious the injury, we use MRI, but it's hardly available and it takes high cost of this imaging. And we would like to compare the diagnostic accuracy of ultrasound and MRI to see is it good enough to quantify the grade of the injury. We checked those patients who hasn't bone injury on the plain X-ray, and we compared the specificity and sensitivity of ultrasound and MRI. After overviewing the literature, we found 10 eligible articles. From we can use 9 articles. Here are the results. The sensitivity results in the anterior talofibular ligament injury. The sensitivity of ultrasound compared to MRI was 97%. It takes from 367 injured patients. We found 352 injured with ultrasonography, which is a very good quality. The specificity wasn't so high, but it's good enough. In 93%, it makes from 152 healthy patients, we found 141 patient healthy with ultrasonography. Here is the two-dimensional regression of our data. On the vertical pivot there is sensitivity, the horizontal pivot is the false positive rate, as known as 1 minus specificity, and the summary estimate marked blue square is in the top of the diagnosis in the left corner, and it shows that it has summary high specificity and sensitivity as well, according to the anterior talofibular ligament injury. The results of calcaneofibular ligament, there was just 7 articles which examined this ligament. Is anatomically are close to ATFL, and the injury method is the same, almost the same than the ATFL. We see here not so high sensitivity, but higher specificity than the ATFL. Here is the two-dimensional regression, which shows us the summary estimate is in the upper left corner as well, and it shows it has a very good sensitivity and specificity, both in the ATFL and CFL, the most common lateral ligament which are injured, meanwhile supination stress. Summary, we can say our strengths are the appropriately selected patient population and circumstantially documented cases, and there is no previous meta-analysis which is investigating only the acute cases, because they were examined the chronic ankle instability cases as well. The limitations, the data quality, there are no RCTs in these topics, and the small number of the eligible articles could be limitation, but we overviewed the whole international literature. In conclusion, I can say ultrasonography could be a good alternative of MRI examination in the diagnostic of lateral ankle ligament injury. Based on our data, it could be primary diagnostic method in the acute cases when you closed the bone fracture already. And we offer to make an appropriate classification system, and practice is required. Implication for practice, ultrasonography, it's easy to use, easy to follow up cases. It's very good to make dynamic examination. We can select those cases where MRI is necessary, and we can make new guidelines for treatment. Implication for research, to develop more sophisticated grading system to give better attendance for the patients. This manuscript is ongoing. My second project will be the cohort study, a clinical trial, to compare the diagnostic accuracy of ultrasound and MRI assessing a medial collateral injury of the knee, which is the most frequent injured ligament of the knee. And neither we have evidence that physical examination can grade correctly the level of the injury. The gold standard is the MRI 2 as the lateral ankle ligaments, but it's hard to access, and we think that ultrasonography could be a good alternative imaging procedure for grading. I would like to examine those musculoskeletally matured patients who has medial collateral injury without meniscus tear or multiligamentar injury. I would like to check them immediately during the first patient visit at the ambulance with ultrasonography, and I would like to send them to MRI in the first week after they injured. And we will check the sensitivity and specificity, compare the ultrasonography and MRI. Yeah, thank you for your attention and your time today.
My question would be that is there no difference if you use different type of ultrasound equipments, or there is a standard detector that everybody use, and what is your impression? Because you mentioned that ultrasound is good for everybody, but there are so many different ultrasound equipments, and the detector, it's mostly related, the result efficiency, to the detector of the ultrasound equipment.
Thank you for your question. In these articles, they are used between 12 and 14 megahertz head, linear head. All of these studies. Yes, of course, it depends on the deepness of the tissues and what you want to see. As you elevate the number of the megahertz, you can earn better picture, but the penetration is lower. But between 12 and 18 megahertz are used for ligament injury for detection. But in these articles, they are used 12 to 14 megahertz.
And what do you think in Hungary, for example, in the outpatient clinics or in centers, they are present or they are available?
It's much easier available than MRI, and I hope so that the ultrasound devices get cheaper and cheaper, and nowadays I think so. It's not so crazy thing to be almost every outpatient clinic an ultrasound. In a better place, there is easily in Austria or in Germany, there are all of outpatient clinic. There is an ultrasound. It's a very professional ultrasound, and I hope so that we will earn this phase.
Just a question, did you have an MRI or ultrasound? Your ankle. Did you have an MRI or ultrasound?
Just ultrasound.
Okay.
MRI not.
Yeah, it was just a joke. Okay, I have a question about that. You did a comparison in between the sensitivity and the specificity of the between the ultrasound and MRI, but you didn't mention that all of these patients were total ligament ruptured or partial ligament ruptured. So if you just check, could you just do a comparison and see the sensitivity and the specificity on the severity of the lesion? I mean, the total, subtotal, or partial ligament rupture. And what do you say regarding that?
Thank you for your question. Yeah, we can see that you are treating those patients. I told it this topic in fifth time, but never earned this question. But yes, with my supervisor, Dr. Károly Pap, we would like to manage a clinical trial to check the sprain, partial rupture, and complete rupture according to anterior talofibular ligament as well, because that's the big question that is good for grading, not just positive or negative. Most likely is how serious is. And MRI is very good for this, not the positive or negative, because just positive or negative we could decide with the physical examination as well. But the grade is the big question. And sorry, but these articles in just one cared about the grading, but that shows that ultrasonography has high specificity and sensitivity for the between the sprain, the partial rupture, and the complete rupture as well. And we would like to make the same method or trial.